This is why, even if you don't trust the media or you think they're big pharma media, it's interesting because you can't always hide everything if you're trying to do your job. This story is a perfect example. CBS News is doing an investigation on nursing home conditions. Now, it's been known for years that nursing homes really don't necessarily deliver the best quality of care for a variety of reasons. There are waivers given to states. States can grant waivers to nursing homes to allow them to be understaffed. It's a very difficult job. The whole premise is wrong. If a person has dementia, you can't force them into a schedule. Virtually every nursing home has to run off of a schedule. I know this. I took care of my mother for 7 years at home. She had dementia. Still remarkable person, remarkably communicative, very self-aware. She just remembered her past more. But she remembered who I was. I was her son. She remembered me. I was grateful for that. And I was there for her every day. And I learned so much being her caregiver. But a couple of times, you know, she'd have to go to the hospital. She had to go to rehab once when she did break her leg. And I learned. I got to experience what was going on in these facilities. And it's better than nothing, but in a way it's not. It is and it isn't. I mean, if you can't take care of your parent, it's way better than nothing. If you could take care of a parent, it's not. That's basically what it comes down to. And those can be financial issues, so nobody should feel guilty if they couldn't take care of a parent because they were taking care of their kids or they had to work. That's understandable. But this clip talks about they're finding all of these violations where everyone's dying from, not everyone, but a high percentage of people are dying from coronavirus. So let's listen to a little bit and discuss this but let me get my thought out right away in case you're impatient. We need medical police in the United States. We need them so badly. We need medical police mixed in with local police agencies and even on location at specific rehab facilities or in hospitals. We need medical police as a third-party witness. Because right now, it's the patient's word against everyone else, or even if you're a family member or a caregiver and you notice something was done illegally or incorrectly or that could have endangered your parent's life, it's still you against the system. There's no third party to call. And this has to change. And we may all be paying the price right now with what's happened, because this whole shutdown everywhere was accelerated by the number of deaths of the elderly. And the protocols that are in place for caregiving for the elderly, I believe, are substandard. So in allowing the medical industry to dictate all the terms for what is considered acceptable, they got caught. Because now a new player came onto the scene, a company called Blue Dot, and they were able to identify sudden hotspots. Those hotspots created an excuse for a worldwide pandemic, and that pandemic was fueled by the deaths of elderly who were being treated substandardly. So I'm going to play a clip now, and then I'll talk a little bit more afterwards.
CBS News investigation into the pandemic's devastating toll on America's nursing homes. We looked into some of the hardest hit facilities and found disturbing track records of failed patient care and oversight, and numerous citations indicating there were problems well known before the virus hit. CBS's Jonathan Vigliotti has been covering the nursing home crisis and has more on these alarming findings.
Tonight, at least 13,000 COVID-19 deaths and counting. In New York City today, reports of nearly 100 deaths at one facility. Investigations now launched coast to coast, including at this Massachusetts veterans home, where dozens died.
It's heartbreaking. Heartbreaking.
The nursing home industry is now pushing for legal immunity. But a CBS News investigation uncovers many of America's facilities had pre-existing deficiencies that experts say made them vulnerable. The top 10 states with the most care deficiencies last year include Florida, Indiana, Michigan, Texas, and California, where for just infection prevention and control alone, 62% of facilities were cited. And CBS News found California homes with those citations also had the most COVID cases. 8 of the top 10 offenders had the lowest rating, 1 or 2 stars. Terry Reyes' father is among the pandemic fatalities.
We wish we had never even put him in there.
There are repeat offenders who will continue operating that way, even if they're getting fined.
Among them, Magnolia Rehabilitation in Riverside, California, which was evacuated because of staff and PPE shortages and lack of training. 3 major reasons experts say homes are being cited.
So there you have it. This has been going on for a really long time. So let's just review this circle that's been created. For years, government basically didn't pay enough to nursing facilities. Medicare doesn't pay enough. In exchange for the quid pro quo of not paying enough, they allowed nursing homes to slacken their standards. They allowed nursing homes to actually get waivers to not have enough workers for their facility based on the number of people that were being taken care of. They had to lower the bar. They had to allow things like strict schedules. They're flexible in their hours, but the bottom line is the seniors, they try to control people who are being psychologically tortured with the end of their life because they're left in a room. They have no freedoms left. They don't get to go anywhere or do anything. They're sad. So their dementia is fueled by this. And because it's probably harder to take care of somebody with dementia, they had to slacken all the rules. So it's all this one big circle. But on top of all of that, by not having medical police, the police stay out of most investigations. So who investigates? The medical board from each state. We can't have the medical board being judge, jury, and sentencer. It's wrong. We don't have that anywhere else in the world, but we have it in the United States. But we have it for our medical board. Medical board should only decide the severity of a penalty once someone else, not the medical board, decides what is right and what isn't right. And that would be medical police. We have coroners. Why don't we have medical police? And that's not even fair to the police officers who every day, the only kind of work they can get is law enforcement of people, that might have guns to kill them. Why can't they be protecting citizens? Which is what they could do if we had medical police in this country. Anyway, this is just the beginning. But just remember, you're out of work, you're losing money, you could be economically damaged for a long time. We don't know how this is all going to end up, specifically because we allowed Big Pharma, which I'll talk about some other time, and medical boards to dictate policy. And now that a new player is on the scene, Blue Dot, that can instantly identify emerging pandemics, suddenly all of their practices from the last decades are being exposed. And even right now, CBS is doing an investigation. Even though tomorrow they may be asked not to do it by Big Pharma, because then we're going to find out what Big Pharma did wrong. And I'll talk about that in another video. Because Big Pharma is to blame just as much as what's going on in the nursing homes.